The lungs are our body's natural air filters, vital for breathing and overall health. But like any crucial body system, they can be damaged by certain factors in our everyday lives. This is why identifying the early stages of lung damage can make a big difference in managing and treating potential issues effectively, which is what we're going to discuss in this video. So, take a deep breath and let's dive into these early warning signs and what they could mean for your health. Number 1. Clubbing of the fingers. Clubbing of the fingers is a physical sign characterized by the enlargement of the tips of the fingers and a downward sloping of the nails. It occurs due to changes in the soft tissue beneath the nail beds, often associated with long-term oxygen deprivation or chronic low oxygen levels in the blood. Commonly linked to lung diseases such as COPD, lung cancer, cystic fibrosis, and pulmonary fibrosis, clubbing can also be a sign of various cardiac diseases. The presence of finger clubbing is a significant indicator that requires a thorough evaluation to determine the underlying health issue. Number 2. Chronic cough. A chronic cough is one that persists for 8 weeks or longer in adults and can be a warning sign of lung damage or underlying respiratory disorders. This type of cough can be dry or produce mucus and is often more pronounced at night or early in the morning. Chronic cough may indicate the presence of conditions such as chronic bronchitis, asthma, gastroesophageal reflux disease, or lung cancer. Persistent coughing can also lead to other complications like headaches, dizziness, and even rib fractures from the force of coughing. Number 3. Shortness of breath. Shortness of breath, medically known as dyspnea, is a common symptom of lung damage characterized by difficulty breathing or feeling suffocated. It can occur during physical activity while at rest or suddenly during the night, known as paroxysmal nocturnal dyspnea. This symptom can be associated with various lung diseases including asthma, COPD, pulmonary fibrosis, and lung cancer. Shortness of breath is a critical indicator, especially when it occurs suddenly or severely, as it can signify a serious underlying health issue requiring immediate medical attention. Number 4. Chronic mucus production. Chronic mucus production involves the continuous production of excess phlegm or mucus by the airways, typically occurring daily for at least 3 months. This symptom is often a defense mechanism against irritants or infections, but persistent mucus production can indicate serious respiratory conditions such as chronic bronchitis, a form of COPD. It may also be a sign of asthma, cystic fibrosis, or lung infections. Regularly coughing up clear, white, or yellowish mucus can make breathing more difficult and increase the risk of further respiratory infections. Number 5. Wheezing. Wheezing is a high-pitched whistling sound made while breathing, commonly experienced during exhalation, and is often a sign of an obstruction or narrowing of the airways. Wheezing is a hallmark symptom of asthma, but can also result from other conditions affecting the lungs such as COPD, bronchitis, allergies, or respiratory infections. In some cases, wheezing can be caused by heart failure or foreign objects obstructing the airways. This symptom should not be ignored, especially if it occurs frequently or is accompanied by other respiratory symptoms, as it often requires medical evaluation to determine the underlying cause and appropriate treatment. Number 6. Blue lips or fingertips. Blue lips or fingertips, a condition medically known as cyanosis, occur when there is insufficient oxygen in the blood, reflecting potential lung damage or severe respiratory disorders. This sign is often seen in conditions like COPD, pulmonary embolism, or severe asthma attacks. Cyanosis can also result from heart issues that prevent adequate oxygenation of the blood. The appearance of blue lips or fingertips is a critical symptom indicating that vital tissues are not receiving enough oxygen, requiring immediate medical assessment and intervention to address the underlying cause. Number 7. Coughing up blood. Coughing up blood or hemoptysis is a serious symptom that can indicate lung damage or severe respiratory conditions. The presence of blood can range from small streaks to large amounts mixed with mucus and may originate from the lungs or bronchial tubes. Common causes include bronchitis, pneumonia, tuberculosis, and lung cancer. Pulmonary embolism, where a blood clot blocks a blood vessel in the lungs, can also cause hemoptysis. This symptom always requires immediate medical attention to determine the source and extent of bleeding and to address any potential life-threatening conditions. Number 8. Chronic chest pain. Chronic chest pain related to the lungs often manifests as a sharp, aching or burning sensation that persists or recurs over time. It can be exacerbated by deep breathing, coughing, or physical activity. This type of pain may indicate various lung conditions such as pleurisy, where the lining of the lungs and chest becomes inflamed, or as a symptom of lung cancer. Other potential causes include COPD and pulmonary embolism. Persistent or severe chest pain should be evaluated by a healthcare provider to diagnose the underlying cause and to prevent possible complications. Number 9. Frequent respiratory infections. Frequent respiratory infections such as bronchitis, pneumonia, or influenza can be a sign of compromised lung health. Individuals who experience recurrent respiratory infections may have underlying issues such as asthma, COPD, or an immune deficiency that makes them more susceptible to airborne pathogens. These repeated infections can lead to further lung damage and exacerbate chronic respiratory conditions, making effective management and treatment essential to prevent serious complications and improve overall respiratory function. Number 10. Chest tightness. Chest tightness is a constricting sensation in the chest that can be associated with lung damage or underlying respiratory conditions. It often occurs as a result of inflamed or constricted airways, which can be triggered by chronic respiratory diseases such as asthma, COPD, or pulmonary fibrosis. This symptom may be accompanied by shortness of breath, coughing, or wheezing, signaling a need for immediate medical attention. Chest tightness can also indicate cardiac problems, therefore, it is crucial to determine its cause through a detailed medical evaluation to ensure appropriate treatment. Number 11. Unexplained weight loss. Unexplained weight loss, particularly when significant and rapid, can be a concerning indicator of lung disease, among other health issues. In the context of lung health, weight loss often accompanies advanced stages of chronic respiratory diseases like COPD or lung cancer. The energy expenditure from the increased effort to breathe, coupled with decreased appetite and the systemic effects of chronic illness, can lead to this weight loss. Persistent or unexplained weight loss warrants a thorough medical evaluation to determine the underlying cause and ensure appropriate interventions are implemented. Number 12. Chronic fatigue. Chronic fatigue in the context of lung health is a persistent sense of tiredness or exhaustion that does not improve significantly with rest and can be a symptom of underlying lung damage or disease. It often accompanies chronic respiratory conditions such as COPD, asthma, and pulmonary fibrosis. The fatigue may result from the body's increased effort to breathe, reduced oxygen supply to tissues, or the systemic inflammation associated with chronic lung diseases. Chronic fatigue can significantly impact daily activities and quality of life, making it essential to address its underlying causes and manage symptoms effectively. Number 13. Swelling in extremities. Swelling in the extremities, particularly in the legs, feet, and ankles, can be an indirect sign of lung damage when associated with pulmonary hypertension or right-sided heart failure. This condition, often resulting from increased pressure in the lungs, forces the heart to work harder, leading to fluid accumulation in the tissues of the lower extremities. This symptom, known as peripheral edema, is important to monitor, especially if it accompanies other signs of lung issues such as shortness of breath or chronic fatigue. Prompt medical evaluation is crucial to address the underlying conditions causing the swelling. But, as you can see, recognizing the signs of lung damage is vital for initiating early intervention and preventing further deterioration of lung health. Symptoms such as chronic cough, shortness of breath, and unexplained weight loss are not just discomforts, they are warnings that warrant attention and action. Individuals experiencing these symptoms must seek medical evaluation to determine the underlying causes and receive appropriate treatment. Awareness and proactive healthcare management are key to maintaining pulmonary health and enhancing your overall quality of life. If you want to support the channel, please like and subscribe. I would greatly appreciate it. There should be some other helpful videos popping up on your screen right about now that I think you will enjoy. And just a quick reminder, we are not doctors. This video is for informational purposes only. Thank you so much for watching. Have a blessed day. And as always, breathe easy, my friend.